Hi, this is the last case of the day for the week, and we have the 83rd case titled Diffuse Cystic Lung Disease with additional findings. And so, this 31-year-old non smoker woman with mild dyspnea, and the CT scan shows multiple thin walled cysts. At first glance, it almost looks like the intervening lung is abnormal, but that's just because there are multiple tiny cysts all over. However, the intervening parenchyma is normal, and you can see the cyst profusion on the minips beautifully here. Now, I've done the snippet 20, and the link should be on the top right, where I talked about a practical approach to diffuse cystic lung disease. And basically, that's the chart. If they are truly greater than 10 cysts, then you have only cysts, cysts with nodules, cysts with other findings. So our patient in the lungs has only cysts, and that would mean one of these five conditions: LAM, PLCH, BHD, LIP, or cystic metastases. The morphology helps, and so elliptical would be BHD, irregular PLCH, septate perivascular LIP, and round would be LAM. But the history also matters. So our patient is not a smoker, so PLCH is unlikely. The morphology rules out BHD. The patient doesn't have Sjogren's or any other connective tissue disease, so LIP is unlikely. So the most likely diagnosis is lymphangioleiomyomatosis, and I had done this 25th case where that was how the diagnosis was made. But when you look at the criteria for sporadic LAM, apart from the consistent HRCT finding, we need one of these six things that are mentioned here. And in our patient, there was a CT abdomen pelvis done a couple of months prior, and that had shown a combination of simple cysts and complex cysts. You can see those ones here in the retroperitoneum and in the pelvis. And then there was a history 3 years ago of one such cyst having been operated, thinking it was an ovarian cyst, and it showed chylous fluid and histopath confirmed lymphangioma. All of these are lymphangiomas. Not only that, I found another one that's not been reported so far in this patient, a supraclavicular lymphangioma. So now we have additional findings, and so even if we don't do the VGFD levels or etc., we have one, the HRCT findings being consistent. Second, the presence of lymphangiomas in the supraclavicular region, so in the neck and in the retroperitoneum. This combination now is highly suggestive of lymphangioleiomyomatosis. That's the classroom starting in about 10 days, my WhatsApp channel. Thank you so much for viewing this.